I was tagged. So you're not supposed to have NyQuil while on SSRIs. Hey, I'm Ethan, I'm a pharmacist. If you're not aware of this counseling point when it comes to NyQuil, I'm gonna go over why. As a reminder, some examples of SSRIs are like sertraline, fluoxetine, and escitalopram. And so it's important that we look at the back of the box on NyQuil because NyQuil just isn't just one medication. There's usually acetaminophen, which is just the generic for Tylenol, dextromethorphan, and doxalamine. The one ingredient to worry about when it comes to SSRIs is dextromethorphan, which is an active ingredient that is used to help with dry cough that you'll commonly see in a lot of cough syrups like Delsum. So dextromethorphan affects serotonin levels in the brain, and your SSRIs also raise serotonin. When you take them together, serotonin can build up too high, and this can cause what's known as serotonin syndrome. Serotonin syndrome can start mild with symptoms like restlessness, sweating, a fast heart rate, or tremors, but then it can become more dangerous with like a high fever, confusion, even muscle stiffness or seizures. So your risk for serotonin syndrome goes up if you're on higher doses of SSRIs, but it can happen at like any dose. Also, if you're taking more than one medication that affects serotonin, or if you're using NyQuil more often and at higher doses, which is why I'm never a fan of these multi-ingredient products, because oftentimes people take too much of a certain ingredient that they're not supposed to. What alternatives do you have if you just want to avoid NyQuil completely to avoid any risk? You can take acetaminophen on its own for like any fever or pain. Then for a dry cough, instead of dextromethorphan, what you can take is you could do honey or Zarbee's.